Hello class, this is Dr. Chapman. This PowerPoint is to accompany Jarvis Chapter 3, the interview. For most of you, this will be a review. Most of you have done many patient interviews. What I'd like to do with today's PowerPoint is to go over some basic techniques and refresh your memory. A health interview is a structured interaction between the healthcare provider and the patient. The rules governing this interaction to establish the rules governing prior to beginning the interview. Although this becomes second nature for structured interviews, the beginning practitioner may have difficulty. It's important for us to communicating the limits and expectations for the interview, especially if the patient is older than the student. But the parameters must be addressed and outlined prior to beginning the interview. To record a complete health history from the patient, and ultimately to provide optimal health care for the patient. The nurse serves as a collaborator between disciplines. One goal of the health interview is to identify the health strengths of the patient and also the problems, and this serves as a bridge to the physical examination. The interview is always the most important part of data collection because subjective data directs and guides the focus of the physical examination. Subjective data provides the nurse with information about the patient and their perceived state of health. Remember that the individual patient knows what their problems are or their concerns are, and the nurse knows nothing until the patient is able to discuss their problems and concerns with the provider. The interview allows the nurse to not only gather complete and accurate data about the person's health state, but also allows the patient to describe the chronology of symptoms of any illness that they might have and other concerns that they are experiencing. A very, very important part of the interview is establishing rapport and trust so that the patient is able to relate and share all relevant data. The interview is the beginning of the nurse's opportunity to teach the person about their health and any disease or illness processes that are going on. The interview allows the nurse to develop rapport with the patient and to begin the therapeutic relationship, in addition to facilitating future interactions with other healthcare providers. Again, the interview is an important place to begin teaching health promotion and disease prevention. The nurse should consider that the interaction during an interview is a contract between the nurse and patient. This contract consists both of spoken and unspoken rules of behavior. For example, the contract includes what the person needs and expects from the healthcare provider and also what the healthcare provider has to offer. The mutual goal is optimal health for the patient. Review the terms of the interview contract listed on your screen. Note that the patient has the right to know the time and how long the interview will last, the purpose of the interview and how that information will be used, that they have the right to confidentiality and to what extent that confidentiality is extended, and patients have the right to choose whether others, family members or friends, are present. In order for an interview to be successful, we must be able to communicate effectively. The following slides will review communication techniques with which you're already familiar and hopefully enhance your skills in communication. As a review, in any two-person interactions, there are usually two roles, that of the sender and that of the receiver. Remember that during the exchange of any information, both individuals engage in nonverbal and verbal communication. In addition to your being aware of the roles of each individual, one must also consider the context of the exchange and any internal and external factors that may have an impact on the interview. Adding yet another dimension to the interview is the fact that each interaction between two people includes an intellectual response and a feeling response. The feeling response is one that we often overlook. The interviewer must monitor both these responses within himself or herself and, when possible, within the interviewee. Finally, the interviewer must be aware of facilitators and blockers of effective communication and review other internal and external factors that must be considered during the interview. How often have you said one thing and had a person totally misinterpret what you said? This slide depicts some of the challenges of communication. What I mean must be decoded by the person who is receiving it, and a lot of different factors will impact how this message is decoded. Awareness of the message you send is only a part of the process. Remember that the receiver will decode the message that you're sending and interpret that message based on words and gestures you have used. Meaning is also determined by the receiver's past experience, culture, self-concept, and most importantly, in the part of the patient, their current physical and emotional state. Successful communication occurs when the sender and receiver receive mutual understanding of the message being sent. The need for high-quality communication is intensified by patients presenting to the hospital, ER, or to the outpatient clinics. Patients depend on you to get better, and to do this, they depend on you for outstanding communication skills, often in not the best of circumstances. Communication can be learned, as you know, and when you're a beginning practitioner, you spend much time polishing your communication skills. Over the years, we often forget the importance of high-quality communication and the skills we learned as beginning practitioners, as the pace of our work environment makes us feel that there's little time to communicate at all, much less with high quality. But remember that communication is a tool. It's as basic to good health care as any of the tools that we use for physical examination. Our ability to communicate. These factors include our ability to like and understand others, experience empathy, and most importantly, our ability to listen. We spend a great deal of time learning to talk, but very little time learning to actively listen. The acronym on the right side of your screen is a good one to use in practice when you find yourself in a hurry and not able to hear what the other person is saying. When communicating, we must take into account external factors that impact the communication process. We must ensure privacy for our patients and, when at all possible, refuse interruptions, allowing the patient to feel important to you at that time. The physical environment greatly impacts the patient's perception of your communications. What has become normal for you will not be normal for the patient. Remember the impact of dress, your physical attire, on what you are communicating to the patient. Being dressed professionally is expected and a critical part of the communication process. While taking notes is certainly unavoidable, note-taking should be kept to a minimum so that you can make eye contact with the patient and let the patient feel that he or she is more than a checklist and that you are listening and care about what they say. Tape or video recording can greatly impact the ability for the patient and you to communicate honestly and openly. While note-taking can't be avoided, it does create certain challenges. Breaking eye contact too often creates a sense of mistrust and not listening. It shifts the attention away from the person, diminishing his or her sense of importance, and often interrupts the patient's narrative flow. It impedes your ability to observe the patient's nonverbal behavior, which is the most important indicator of communications, and it may be threatening to the patient when they are discussing sensitive or private issues. Electronic communication has created its own set of challenges with communication. When you're charting electronically, often your back is to the patient, and often the nurse is perceived as more interested in the computer than the patient. There are many things that you can do to decrease the amount of time you spend looking at the computer screen, and whenever possible, face the keyboard so that you're facing the patient. There are 3 phases to the interview. During the first phase, the healthcare provider introduces the interview. The working phase is the data gathering phase, and we use both open and closed-ended questions during the interview. Closing the interview is important because it signals to the patient that the interview is ending and gives the person one last chance to share concerns or self-expression. Be sure to provide a brief summary of what you have learned to validate what you have learned during the interview. Now let's review some specific communication techniques, beginning with open-ended questions. Open-ended questions are appropriate when we need a narrative response. We'll be stating topics only in general terms. Open-ended questions allow the patient to provide additional information and often provide insight that we would otherwise not have into the patient's condition. They're often appropriate to begin an interview, when we introduce a new section of questions, or whenever the patient introduces a new topic. For example, a patient coming into the ER with chest pain, an example of an open-ended question would be, "Tell me what happened before you came to the hospital today." A closed-ended question would be, "What brought on this chest pain?" Can you see how the 2 questions will elicit different quality and quantity of information? Closed-ended questions are appropriate when we need information specifically, when we need a yes or no answer, or the patient has to make a choice. For instance, are you having chest pain now? Do you smoke? Use them after you have an opening narrative to fill in any details the patient may have left out, or when you need specific facts. When the interview needs to move along, closed-ended questions may be indicated. Techniques that assist the narrative and elicit more information are to be reviewed, and I would like you to know examples of each of the different types of responses. Facilitation is a technique that encourages a patient to say more and shows you are interested and will listen further. Leaning forward, nodding your head, saying are examples of facilitation. Also, general leads such as yes, or using your hand to gesture, "Go on, yes, I'm with you," encourage the patient to continue talking. Silence is probably one of the best techniques we can use after open-ended questions. Silent attentiveness communicates to the patient that they have time to think and that you are listening. Thinking silence is the one where healthcare professionals interrupt most often because it is uncomfortable. When you ask a question, give the patient time to answer. Don't fall into the trap of answering for the patient or interrupting. Reflection echoes the patient's words. Repeating what the patient has said, it focuses the patient's attention on a specific phrase and help the patient continue on with his train of thought. For instance, "I'm here because I couldn't urinate." Period. Your response might be, "So you couldn't urinate today?" You're echoing back what the patient says to help them expand on their symptoms. Reflection also helps express feeling behind the person's word. The feeling is already in the statement. You focus on it and encourage the patient to elaborate. For instance, "I wish that I had been there when my son was in the car accident." Your response would be, so you wish you were there when your son was in the car accident. This encourages the patient to elicit further information and express feelings. Empathic communication is recognizing a feeling and helping the patient put it into words. For instance, the patient says, "I don't know what I'll do without my husband here. I hate being in this hospital. I don't have any privacy. I am just freaking out." The nurse says, "You must feel very scared and lonely." Naming the feeling and allowing expression of it helps the patient feel accepted and can deal with their feelings more openly. Clarification is the technique used when the patient's words are confusing or ambiguous, and to summarize their patient's words and to clarify that you have indeed heard the message that the patient was trying to communicate. Notice that in the last 4 responses, the frame of reference was from the patient's perspective. We're now shifting to communication techniques that should be used sparingly because they shift the frame of reference to the nurse's perspective. Confrontation is one of those and should be used very sparingly. You may use it to focus on a discrepancy or inconsistency in the patient's narrative. For instance, the patient says they do not smoke, but you notice a pack of cigarettes in their pocket and they smell like smoke. You may say, "You told me in the history that you don't smoke cigarettes, but I notice you have a pack of Camels in your pocket. Could we talk about that?" You can also use confrontation when you've observed a certain action or feeling and you want to focus your attention on that. For instance, the patient says that they have no pain, but you notice when you touch them they grimace. You might say, "You say you're not having pain, but your brow's all wrinkled up, and when I touch your stomach, you jerk away. Let's talk about that." Confrontation can also be used to give honest feedback of what you see or feel. Interpretation is based on your conclusions about a communication. It helps make association or implies or ascribes feelings. It may help the person understand his or her own feelings. And if you're incorrectly interpreting a behavior or feeling, the patient can clarify. For instance, the patient says, "I've decided I don't want to take any more of that chemo, but I don't want to tell the doctor because I think he'll be disappointed." You may interpret, could it be that you're afraid of the chemotherapy? The patient then can clarify. Again, this is a communication technique that shifts the perspective away from the patient onto the nurse and should be used very sparingly. Explanations are probably what we feel most comfortable with. Teaching, explaining what's going on, giving facts and objective information. Again, the focus is on the nurse and not the patient, and these explanations should only be used when appropriate, as in teaching situations. It's much more comfortable to talk about the hows and whys of something than feelings, when oftentimes the patient needs to talk about their feelings. And in summary, it's very important at the end of an interview to summarize and validate that what the data you have collected from the patient occurs. Oftentimes as nurses we skip this step and the patient's left without feeling closure to an interview or interaction. The 10 traps of interviewing. I ask you in your last study guide to identify 10 traps of interviewing that you had seen in your colleagues or yourself over the last week, and to be able to give examples. I'd like for you to bring those examples to class and have us discuss them at the beginning of the next class meeting. You may want to review pages 35 and 36 in your text to help you remember these 10 traps of interviewing. In addition to the verbal communication techniques we've talked about so far, we need to be aware of the other predictors of successful communication. Nonverbal skills are very important, and we as nurses need to be aware of our nonverbal communication. What are we communicating nonverbally versus verbally? We need to be aware of the physical impact of our physical appearance on our patients, as well as our posture, gesture, facial expression, and eye contact. Our voice tone is very important, and we need to be aware of how we're saying what we're saying. Touch is used in nursing, of course, but we have to be very careful about when we use touch and when not to use touch. Knowing the patient's cultural background and age is very important when considering touch. And when in doubt, ask. Closing the interview again is often a step we skip as nurses and leaves the patient without a sense of closure. Think of the last time a friend walked away from you without saying goodbye. How often do we leave the unit for the day or the ED without telling the patient goodbye or bringing some closure to a very important interaction? In addition to being aware of what we are communicating to a person nonverbally, we need to look at nonverbal indicators of what the patient is communicating to us. Vocal cues are probably the easiest for us, but action cues such as posture, facial expression, and gestures can tell us a lot about how a patient is feeling and what they're thinking. Look at their clothing, jewelry, and hairstyle to tell us a little bit about where they are and who they are. Be aware of personal space. Remember that we all have our own personal space, and in the U.S. that's about 3 feet. As nurses, we have to invade the personal space, and that will increase anxiety. Remember that touch, even when we're doing procedures, involves use of personal space and will increase a patient's anxiety. Of course, informing the patient prior to touching them is always appropriate. In summary, this PowerPoint has summarized Chapter 3 in your text. We've talked about the ability to establish the parameters of a health interview. We've stated factors that affect communication. We've described 3 phases of the interview and outlined communication techniques that are appropriate to help the patient with communication. We've learned the 10 steps of interviewing and discussed the importance of nonverbal and verbal communication. We will now move on to the health history. Don't forget to bring your 10 interviewing traps examples to class with you, and we'll move on from here. Thank you. Bye-bye.